Hello guys, so hope you are all okay, you're all enjoying your life, and welcome back to Dr. Arshad Nadeem Awan radiology and ultrasound teaching video. Today I'm going to discuss about the meningioma. Meningioma, it arises or originates from the arachnoid cell rest, and WHO has classified this into three categories. According to WHO classification grade 1, it happens to be a typical meningioma with a benign characteristic, and 90% happens to be typical, while WHO grade 2 classification shows that is an atypical feature with increased mitotic activity and necrosis. As far as grade 3 classification is concerned, it happens to be anaplastic and highly malignant. So far the age is concerned, it's usually seen in 5th to 6th decade of life, and the location is quite common in supratentorial involving the falx, or it involves the sutures, or it olfactory groove and optic nerves as well. If it happens or it occurs infratentorially, it will involve the posterior fossa. So far the characteristics of meningioma is concerned, it always shows bone sclerosis in particular. And if you look for the type, so it happens to be two types. Either it will appear as a well circumscribed mass, round mass, or it may be flat or infiltrating. With regard to meningioma, you always keep in your mind, if there is multiple meningiomas along with cranial nerve tumors, must think of neurofibromatosis too. And if there is meningioma in the children, because in the children it's quite rare, if there is meningioma in the children, again look for the neurofibromatosis too. How it will appear on the CT images, MR images, how we will appreciate that on these images. So let's start watching these images. The above axial CT images, the color coding picture is also given along with the normal axial CT image. Here on this image you can appreciate a posterior fossa, well defined, hyperdense, extra axial lesion can be seen, and you can appreciate that there is a calcification in that along with an intense uniform. However, it's not the uniform enhancement, it's a patchy enhancement, but you can still appreciate that. So far the bone hyperostosis is concerned, this you can only see when there is bone window. Above given slide indicates and shows a common spherical well circumscribed lesion, that is meningioma. Meningioma happens to be either flat or maybe in a round form, which you can appreciate here on that image. This image shows a hyperdense mass with a calcification as well. So this is what the meningioma will look on the CT axial images. Another example of the meningioma, that is a well-defined round hyperdense mass in the extra axial region involving the frontal lobe, and that is how the meningioma will appear on the ultrasound or on the CT images. So far the surrounding compression is concerned, you cannot appreciate this on the CT images. For that vasogenic edema and for the dural tail sign, you have to do the MRI imaging. On this above given slide, you can appreciate a well-defined round spherical mass involving the temporal lobe. So temporal lobe is occupied by a large hyperdense mass. As you know that slightly Selvian fissure is compressed upward. So for midline is concerned, it is also indicating midline shift. However, we cannot appreciate clearly the vasogenic edema, but to some extent surrounding area shows that there is mass effect. So this is how the meningioma will look on the axial CT images, and that meningioma is in the temporal lobe. A well-defined hyperdense lesion at the frontal lobe with the internal hemorrhage is seen, that is meningioma with great progression and internal bleeding. If you see the falx cerebri has been compressed, like central compression is there. As far as the right sided anterior horn of the lateral ventricle is seen. It is also compressed. Surrounding hypodensity indicate that there is cerebral edema, so this is associated with vasogenic edema as well. So this is what the example of the meningioma, extraaxial meningioma associated with hemorrhage and surrounding edema. For the better diagnosis, it's better to have the MRI scan to look for the dural tail sign and the degree of the vasogenic edema. As per WHO classification, the grade 1 would happens to be benign. That was in first two slide I have shown you, and that is the grade 2 WHO grading, that would be called as an like atypical feature with an increased mitotic activity because it is rapidly progressing. And the second thing is central necrosis is present there, so that would be fall in category 2 or grade 2 of the WHO classifications. Above axial images of the brain CT with bone window and soft tissue window can be seen, and here on the right side you can appreciate a well-defined, hyperdense lesion arising from the frontal lobe associated with marked vasogenic edema with the compression of the means a midline shift and compressions of the ventricular system, and that is the hemangioma. On the opposite towards the left side bone window, you can appreciate that there is hyperostosis. Hyperostosis is the feature of the meningioma, and it shows the origin of the meningioma from where this is attached or arising from the dura mater arachnide granulation. So this is what the meningioma will appear on the CT axial images and on the bone window to look for the hyperostosis. A well-defined hyperdense lesion with calcification seen in the midline in the frontal area, so that is a meningioma, and that meningioma is showing calcification within it. So this is perhaps looking like a grade 1 benign meningioma. Another example of the calcified meningioma on the axial CT images involving mainly the temporal region. As in view, you can see the Selvian fissure is there. However, the surrounding edema we cannot appreciate here on that image. For that you have to have the MRI for two purposes: to appreciate the dural tail sign and to have the vasogenic edema seen on that. However, in this scan you can just see that there is a calcified meningioma which quite easy to diagnose. Another example of the calcified meningioma on CT axial images in the temporal lobe, minimal compression is seen compressing the anterior horn of the right sided lateral ventricle. On this image slightly brain degenerative changes can also be seen, so the patient is a senile age patient. In the introduction I have mentioned, if you see that there is meningioma in the children, so that you must think of neurofibromatosis type 2, but this is actually an old patient. And if even in the old patient there is multiple meningioma and cranial nerves tumor, still you can think of neurofibromatosis type 2. So this is what temporal lobe calcified meningioma. Another axial image where you can see very small rising meningioma, and that has been calcified. So this is what the calcified meningioma will appear on the CT images, and quite easy to establish on the even non-contrast CT images. Detail about the meningioma has already been discussed with grade 1, grade 2 and grade 3 malignant or anaplastic meningioma, and the age peak age 5 and 6 decade has been already discussed. Mainly happens to be supratentorial, and you can appreciate that on CT images which will be appearing as an hyperdense extraaxial mass with calcification. On the MR you can appreciate vasogenic edema associated with the dural tail sign. I do hope this would be a worth watching video, so keep watching and keep sharing with other colleagues. See you in the next videos. Thank you.